Well, welcome back to Oracle TV. We are going to kick this off with our first guest, and I am sitting here with Chris Vernaci, who is the Associate Vice President of Technology Ventures at Universal Health Services. That is a long title, but a good one.
Yes. Yeah, it's a long title. There's a lot of work to do. So I guess the title sort of fitting from that
matches
perspective.
the work, and I appreciate that. And, Chris, it's great to be sitting here with you and talking with you about the work that you're leading, because we know each other and we've been at this for a while. So let's just start there. Talk to me about the work that you're leading with UHS.
Yeah. Serendipitously, I think the work that I'm personally doing at UHS is just so much of an extension of the work that you and I have been doing for a long time now.
Yeah.
I met UHS through some of the work that you and I did years ago. And so that was my introduction point. And to me, it's kind of just like the last mile. It's sort of completing this digitization of health records, driving clinical improvements. And, at the end of the day, like going from carrying your bag of medical records from doctor to doctor, like we're still solving some of those problems. And now I'm on the provider side doing that. The skill set and the problems are not much different. So it's just a different perspective, maybe.
And isn't that interesting? We're in this fast forward motion moment, but we're still dealing with some of those problems of carrying the bags and the papers and all of those from appointment to appointment.
That's right. Yeah. And, what I appreciate being on the provider side, especially one like UHS, is just the scale.
Yeah.
So we have 29 acute care hospitals around the country, 346 behavioral health locations between inpatient hospitals as well as outpatient therapy. So when we are trying to solve a problem, like the scale that we're trying to solve the problem is massive.
Yeah.
And, so now being on this side of the table, that's where I probably have more appreciation for big problems, not a lot of resources to go solve big problems in healthcare.
Talk to me a little bit about those problems. What are some of those challenges that you see?
Yeah, I mean, nothing unique and novel. It's in the sense that there is so much administrative burden in healthcare. And I think that we thought in the industry that we were going to digitize medical data, and that in of itself would relieve the administrative burden. And it just didn't.
It became a diary.
Yes. And, and so that's where we have been focused now with, advancements in healthcare technology, leveraging artificial intelligence when the time is right to really go tackle all those administrative burden areas where it's labor intensive, complicated. And usually for us, it's just work that couldn't get done. And so now we are able to get more work done, quite frankly.
And that's really, you looked at those challenges and you thought this is where we need to modernize that patient and clinician experience.
Yes.
And, going on from that, how is the clinical AI agent improving the patient and workforce experience?
Yeah. So, where we are leveraging AI around administrative burden areas, I would say we first started last year and spent most of our time in the back office, billing, coding, collections, because that's where there's a ton of process that just doesn't get done. This year, our focus has been more on clinical operations. So we work through methodically in our business offices, what are our big bottlenecks? And let's leverage tech and AI to address those bottlenecks. Now we're taking that same way of working and saying, okay, in our clinical operations, what are the bottlenecks? And leveraging tech to alleviate those bottlenecks. CAA, some would argue like you've had physician documentation now for 20 years in the industry. And you've had voice dictation. If you just go compare the output of a traditional physician note, even using voice dictation software, to the output of an AI assisted note that something like CAA creates, just right away, you see a very big visual difference. The amount of detail that is in that note. And yes, it frees up physician time, but I think more importantly, the detail in that note becomes the patient's story all along their care journey.
And that's important, to be able to see this like a story. And that leads to the desired outcomes. That leads to what happens next in your journey.
And so I think frequently the value of an ambient scribe, it always gets talked about in terms of clinician burnout. Yes, I understand that.
And I know it's almost like we don't even want to say burnout anymore, but we have to, because it's real still.
It's very real.
Still being addressed. Yeah.
You know, I would say I have business burnout. I want to use an ambient scribe in all of my meetings too.
Right.
So I totally get that. But I think the most valuable part of these tools are what happens next after the note is generated. And a more complete note, again, it's that story that follows the patient. When they get discharged from our hospital, that story goes with them to their post-acute care. When our clinicians are trying to discharge a patient, having a more accurate story helps us get them out of the hospital faster.
Yes.
You know, and then from a direct business benefit, it helps us with billing, coding, and collections.
Yeah.
It helps us not miss important documentation that our business office teams also rely on.
Every single layer.
Yeah.
It's impacting every single layer. You know, are you hearing feedback that this is having a positive impact, or what are you hearing?
Yeah. Lot of great feedback. We've got a lot of experience. I'd say coming up on 12 months that we have been using CAA in our physician practices. And our physician practices are all specialties.
Congratulations, coming up on 12 months.
Yeah, thank you. Our physician practices are all the specialties, primary care, cardiology, you name it. And, you know, I think what's impressive, we always say users vote with their feet. And this has been one of those deployments where without a lot of change management, that the users are adopting it. Sometimes on 100% of their notes, which is very rare. And you and I both know there are some specialties that are ahead of the curve or behind the curve. And some of the ones that are usually behind the curve are using it on 100% of their notes. So
that's interesting.
So we're meeting the objective of saving physicians time. I think we are helping the burnout. Again, what I think is more interesting is how we see that continue to play out and all the other downstream impacts and patient care, quality, and experience.
Well, you know, Chris, as we talked about at the beginning, we've been at this for several years now, and we have felt that, you know, that from the digitization of healthcare to the hype in AI, and now we're seeing this be put into practice. You know, I hear people call this the great healthcare reset. Some people say it's the AI healthcare era. That's what it was. What do you call it? What do you think this is? And what helps you be the most optimistic about where we're going?
Yeah, I refer to it as the so what era.
The so what era?
The so what era.
Tell me more.
Yeah. And I did not coin that phrase. There are some folks that I have worked with over the years.
No, you take credit for that.
Yeah,
it happened right here on OTV.
I'll take credit for it now. You know, for years we digitized the record, and then algorithms and machine learning came along, and so we took that data and we summarize, here are all the patients that have a gap in care and their chronic condition, and there is a next step in their journey that needs to be taken, and somebody needs to intervene, and we called that population health. We're going to drive down the cost of care because we're just going to make the community more healthy. What I didn't have an appreciation for when I was on the tech side, that I have more of an appreciation for now working on the provider side, is that there's still a capacity problem in healthcare. And so surfacing analytics and insights, great, but who is going to pick up the phone and call that patient to get them to the next step in their care journey?
Right.
And so now, leveraging AI, we can start to augment our staff that did not have time to get to these very important follow-up discussions with patients. And so, you know, for us, we can now 10x the output of a nurse because we can augment the things that a nurse doesn't really need to spend time on anymore, and only push the things to a nurse that requires a nurse intervention. And so that's what I mean when I say the so what.
That's a big deal, and that's a big deal.
We've digitized the record. We've done the analytics. We've identified all the registries and gaps in care. now we can orchestrate care leveraging AI to really go do the work that no one had capacity to do. So I think AI starts to solve not just like the cost, and the efficiency problems, but it's a capacity problem in healthcare.
Yeah. It's a capacity problem, and it's proving it.
Yes.
It's showing up in that space. I like that. So the so what era. I'm going to add that to my list. But I think that it's great to see, in this moment we're at HIMSS, the excitement on the floor that we are beyond that hype, that we're in this, whether it's the AI healthcare era or the so what era, but we're here and it's going to move and fast forward. Chris, it's always a joy to sit down and talk with you. It's been a pleasure to work with you over the years. And I know that we're proud as Orbital Health to continue to work with you and helping to transform healthcare.
Yeah, feeling is mutual. Thanks for having me.